Hi everyone, welcome to Follow Your Heart here at the Natural Parent Magazine. I'm Anne Cullen and breastfeeding is the topic today. What I'm going to talk about specifically is laid back positioning. So first I'm going to tell you what I see people doing kind of wrong when it comes to breastfeeding and how you can solve some of the most basic problems. Now, when I say wrong, the reason there is a wrong is if your baby is really unsettled, not gaining well, or you're in lots of pain and have nipple damage and all of that. So if any of that stuff is going on, there's a breastfeeding problem that needs to be fixed. Very often it can be fixed with changing the position of your body and of your baby's body, one or the other or both. Now, let me tell you about some of the problems I see. And like I've said, if everything's going perfectly, you've got no pain, baby's gaining, baby's settled after feeds and all of that, then just keep doing whatever is working. You have figured it out and that's great. But if you are having some problems with pain or an uncomfortable baby, let me tell you some of what I see. I see lots of people doing either what's called a football hold or a rugby hold, which is baby held under your arm. This is my baby. Baby held under your arm and essentially lying on their back. Okay, and a lot of times this position just doesn't work very well, and I'll tell you why in a minute. The other problem I see all the time, other than that one, is mums who are sitting up, turning baby in maybe, or baby twisted, kind of arms in the way and all of this. But mum is sitting in a really uncomfortable position. She gets sore neck and shoulders, sore arms, sore back. She's just uncomfortable. So even if the positioning you're working with your baby isn't causing you nipple damage or pain, if it's causing you pain in another part of your body, then you can fix that. You don't have to sit and be uncomfortable. Okay, so I'm going to tell you what your baby needs, and we're talking specifically about in the very beginning of life, carrying on for several weeks until you've got things sorted. And if I see a client at 3 or 4 or 5 months, I go over these same principles with them if they're still struggling to get a comfortable, good breastfeed. So it can be something you can try out even if your baby's not in that newborn period anymore. But I really hope that you will share this video with all the expectant families that you know and any new mom that might be struggling with breastfeeding. So what your baby needs is for its entire tummy, chest, and rib cage to be touching you, whoever is feeding the baby. They also need their hip bones to both be touching you. So we want both hip bones and that rib cage touching you when you're holding baby to feed. It's also really good to think about, especially when they still kind of have those little froggy legs and their knees are all squished up, the insides of their knees both on you. And the other thing that sometimes is forgotten is the feet. Holding your baby's feet, letting them land on your lap or the chair that you're sitting on, having something to give them that little sense of security. So it can be the tops of their feet and the bottoms. Sometimes when baby is really unsettled, literally just holding gently onto the feet is enough to calm them down. The other thing we want is one arm on either side of the breast, or if you're very large breasted, and I often talk about hugging the breast. If it's not possible for them to quite hug the breast, at least one arm or hand on either side of the nipple. So before we position our baby like that, you are going to get comfortable first. So I'm going to show you, I'm going to be moving around a little bit more than I sometimes do. So behind me, I've got my pillows because I love to sit in the corner of a couch. I often get my clients to sit in the corner of the couch. Now this is just going to depend on your furniture. So I don't want my back to hurt. I'm going to be sitting here for a while. So I've got my cushion behind me and I've got a couple of pillows and blankets here ready to put by me as needed. And I'm going to think about how I'm going to be the most comfortable, because I'm going to be holding my baby for a while. So I'm going to put my legs up. I'm going to lay back nicely. And I'm noticing this arm over here doesn't have much support under it. So there, yeah, this is pretty good. Oh, I might put this blanket over here to support this arm. Nothing on my lap. And then, yeah, that feels pretty good. Now I'm going to take my baby and I'm just going to hold baby into my body. Now I'll probably have the head up higher than the nipple. And remember, we want the hips, the knees, the feet, everything turned in to mum. And I've got my baby hugging the breast. So we want to be careful of this arm down here so it's not too trapped. Make sure it's comfortable. We're not going to hold down the hands. We're going to allow freedom of movement. Baby is not swaddled at all or wrapped up in any way. If we need to, because scratchy fingernails or whatever are getting in the way, we can gently pull baby's hand out of the way once in a while. But it's best for baby to have really free movement of his or her hands. Now, one of the ways I often talk about this position for feeding is, imagine it's like your baby is doing a push-up. So what happens is we get something called positional stability for baby when he or she is like this, and their head has the best chance of a nice range of motion. So I kind of notice babies doing this little kind of push-up. Right? So it's not because they have a strong neck. It's because you've put them in a position that allows them that freedom of movement. So when baby's like this and we're laid back nice and far, now if I let go, baby's not going to roll off of me. If I'm sitting upright, I've got to work to hold baby to me. Baby can easily go into a startle reflex as they roll off of me, and that can often cause back arching and just uncomfortable baby. But if I'm laid back so much so that if I were to let go of baby, baby's not going to roll off me, it's really, really nice. My breast and nipple fall to their natural place, and then I play around with where does my baby need to be. My baby might need to feed more up and down. My baby might need to be straight across me or at any angle. It doesn't matter. It just depends on where your breast and nipple is, how big your baby is, how big you are. Some of us have bellies that stick out more. You know, we're all different. So when baby's like this, then we put baby near the nipple. Now you don't even have to be watching for a wide open mouth. You don't have to get baby tilting that head back. It just will more naturally happen that baby can latch on properly. Doing it this way means your baby has gravity and all the things that are helping it. So the jaw and tongue fall forward. And baby really has the best use of their mouth and their entire body. And you are comfortable and you can sit that way for a while. Now, sometimes this takes a bit of getting used to. You'll notice sometimes, especially moms who have a lot of breast tissue, you know, baby's nose gets all stuck in and it's really a little bit difficult at first, but minor adjustments of baby, pulling baby's feet this way to get that nose a little bit more clear, remembering that what you're looking for is baby's chin touching the breast and the nose quite close. We don't want the opposite. If there is no pressure from the chin onto the breast, you know that you need to tweak the positioning a little bit. And I know sometimes moms talk about, you know, baby, can my baby breathe? Can my baby breathe? Your baby won't keep feeding if they're not able to breathe. But if you notice it's really noisy and they're quite snuffly, it's okay to adjust the position a little bit. What I encourage you to stay away from doing is keeping your hand on the breast constantly or pushing down. It could cause a block or something. So it's better to change the position of your baby or consider, can you move your body? So you might need to lay back more. You might need to sit up slightly. You might need to twist your body one way or another. If you need some help, try and get someone in to see you in person, or someone like myself that can see you online to help you figure out the best fit for you and your baby. So I hope that helped. That's a longer video than normally what I put out, but this stuff is so important. And if you can get your positioning in this nice, natural, laid back way, it saves most breastfeeding relationships. And I really hope that helps. Let me know what you think. Thank you so much. Keep following your heart. I'm Cullen. Bye for now.